Hi, I'm William. Today's question, it's the biggest question of all, is how do I perform the prostate massage once I'm in? What do I do with my finger? What do I do with the instrument? How do I do it right? Sometimes people say it hurts too much. Sometimes they say they feel nothing. They're getting no results. So the first thing we're going to do is just learn the correct motion. This is most important. And the vital part here is that you don't poke your prostate. Now let's pretend this is your anus right here. This is your spine where my knuckles are. This is your stomach. Your prostate's going to be located up on the belly side. So your finger's going to go in this way. So you can pull down this way. Or if you're reaching yourself, you're reaching in a curve this way so you can reach toward your belly. Now the motion is this. It's not, let me do what it's not first. It's not like having intercourse. You don't rub like this. That's poking. You're going to keep bumping it, you're going to hit it, you're going to bruise it, you can injure it, you can cause yourself a lot more pain. Never poke. You'll find a lot of people when they do exams, poke. Talk to them, say please, be gentle, rub. Because that really hurts. If you ever had one of those exams, you hurt for like 3 days after. It's not necessary, and for our purposes, it's totally wrong. The best motion is a gentle little motion like this, okay? I call it the come hither motion. Like pretend you're calling somebody that you really want to see gently, and it's like, come here. Now how your finger bends? It's not like come here, where you're boom, 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 boom. It's very gentle. It's a very light stroke. Now, your prostate's going to be located inside about a finger's distance up. I'm going to use this as if it's the prostate. Your finger's up, this is your anus down here, your rectum here. Your finger comes up, and you want to rub your prostate like this. Big problem is, most of us, especially reaching our own, can't get our finger much more than at the base. Still feels nice, will still do something for you, but it's not going to give you a good prostate massage. You want to be able to reach the whole prostate like this. Okay. Now also notice the motion of my hand. Okay. If you're inside the anus here, as you're pulling back like this, your finger is going to withdraw just a little bit. It's not the motion like I said, like a poke, like intercourse, like a big old shove. Notice how it's just moving back a little bit. And what that's doing is as it's in there, it's rubbing over the prostate and pulling back on it. So you gently cover the whole area. You want to cover the middle, you want to cover the sides, you want to rub the whole thing gently. This gives the most blood flow to your prostate. It cleans it out the best. It's like when you rinse a towel under the faucet, you squeeze the whole thing. You don't just squeeze the corner. Squeeze the whole towel. That's what you want to do on your prostate. You want to rub the whole gland. Now, because you can't reach that far, you're going to need an instrument of some kind. Different instruments have been used over time, and it's nothing really like some special instrument developed by a company. People have used cigar tubes, used things like carrots, anything that can get in further than the finger. You never, ever, ever want to use anything made out of glass or that's breakable. If it breaks in there, you can cut yourself, get a terrible infection, actually die from it. So nothing that will break. Ideally, a piece of wood is perfect, which is how I got on the drumstick method. How did I find a drumstick? I used to play drums. Now, notice the tip is rounded, it's wood, it's smooth. Not going to break off inside, and the beauty of it is no matter where your prostate lies or how long or short your finger is, the drumstick can be adjusted once you're in there. So my finger is this long. If I can only reach the tip of my prostate, notice the drumstick goes all the way up there. The drumstick, however, does not bend like the tip of your finger. It doesn't have to. What you're going to do, you don't have a lot of room. Remember, you're in your rectum. It's about this wide at a stretch. So what you're going to do is you're going to put it in, lean it on your prostate, and notice just a gentle little angle of the prostate. See how little that is? that will give all the extra little push you need, and then you withdraw it a little bit and go back in. So it looks like this in your rectum. It's like boom, boom. Again, not a big poking motion, just a little, like that. And just like your finger, you'll be able to reach the top and the sides. Now, here's the ideal instrument today. It's the right size for almost every man. Some might need a little shorter one, some a little longer one. They have them. But I would suggest everyone try this one first, simply because it fits most men perfectly. Goes in your anus like this. Again, well lubed. Always, before you put anything in there, a lot of lubrication. On the anus, on the instrument, on your finger. Always a lot of lubrication. Better too much than too little. Slide it in. Now, an Eros is made to work with just the movement of your sphincter. Contracting, like close your anal muscles. What it will do, because of its shape, it will push. As you squeeze your muscles, it'll move like this and push right down on your prostate. Perfect, hands free. When you want a little more intensity, just like the drumstick, grab it with your finger by the end. Do that slight little angle that I showed you, exactly like with the drumstick. That same little pull out like that. Hope you can see that well. And what that will do is it will rub it just the same way, right on the prostate gland. Again, do the sides, do the middle. I recommend, if at all possible, you learn to do your own. It's the best. The reason is you control exactly where you're touching at all times, the middle, the sides. You can work on the areas that are most tender or that need the most massaging. It can be more gentle. You can put on a little extra pressure. You know exactly what feels right. Never go too long. If you start to get any pain of any kind, lighten up. If it's still painful, stop. Give yourself a day's rest. Try it again.